Assalamu alaikum. I'm Dr. Faiza. Today our topic is musculocutaneous nerve. So this musculocutaneous nerve, it originates from the ventral rami of C5, C6, C7 roots of spinal nerves. Its course is it is present in the lowest part of the axilla at the lower border of pectoralis minor muscle. Here you can see this pectoralis minor muscle. It arises at the lower border of pectoralis minor muscle. And it terminates as the lateral cutaneous nerve of forearm 2 centimeter above the elbow. So relations of this nerve is in the lowest part of axilla. It accompanies the third part of axillary artery, and anteriorly there is pectoralis major muscle. This is pectoralis minor muscle. Above this muscle is pectoralis major muscle, which is cut off. So the relations of musculocutaneous nerve in the lowest part of axilla is anteriorly is pectoralis major muscle, posteriorly is subscapularis, laterally is coracobrachialis, and medially is third part of axillary artery and lateral root of median nerve. So this musculocutaneous nerve, it leaves the axilla and enters the front of arm by piercing the coracobrachialis muscle, and it runs downwards and laterally between the brachialis and biceps brachii. Here you can see the tendon of biceps brachii, and this biceps brachii muscle is cut off. So it runs downwards and laterally between the biceps brachii and brachialis and reach the lateral side of tendon of biceps brachii, and it ends by piercing the deep fascia 2 centimeter above the elbow. So its muscular branches are to the coracobrachialis, biceps brachii and brachialis. You can learn from the mnemonic BBC that biceps brachii, brachialis and coracobrachialis. And cutaneous branch is the lateral cutaneous nerve of forearm, which is the termination of this nerve, and it supplies the lateral side of the forearm. And articular branches is to the shoulder joint along with the nutrient artery, and to the elbow joint, through nerve to brachialis muscle. So it has also communicating branches, which is communicating with the superficial branch of radial nerve, the posterior cutaneous nerve of forearm, the palmar cutaneous branch of the median nerve through lateral cutaneous nerve of forearm. So remember, it has muscular branches which supplies the biceps brachii, brachialis and coracobrachialis, cutaneous branches which is the lateral cutaneous nerve of forearm which supplies the lateral side of forearm, articular branches to the elbow joint, to the shoulder joint. Communicating branches, it communicates with other nerves. Number 1 is the superficial branch of radial nerve and to the posterior cutaneous nerve of forearm, and the palmar cutaneous branch of median nerve through lateral cutaneous nerve of forearm. So when there is injury to muscular cutaneous nerve, so there is paralysis of biceps brachii, brachialis and coracobrachialis, and there is weak flexion at the shoulder joint, as this nerve also supplies the shoulder joint. So when there is injury to musculocutaneous nerve, there is weak flexion at the shoulder joint, weak flexion at the elbow joint, and there is weak supination of forearm. But the supination and flexion, it is weakened, not lost, as this flexion is also caused by the brachioradialis and supination is also caused by the supinator muscle which is supplied by the radial nerve. So when this nerve, musculocutaneous nerve, is injured, this flexion and supination function is weakened, not lost. Remember this, okay? And when this nerve is lost, there is loss of sensation on the lateral surface of forearm, as this lateral cutaneous nerve of forearm, it supplies the lateral surface of forearm.